So the origin story of this company was that Dr. Shiv Rao, a cardiologist, was VP of Innovation at University of Pittsburgh Medical Center, an $8 billion medical center, and I met him at one of our MIT healthcare hackathons. And he was thinking about starting a company, and I encouraged him to do so. And he did it in partnership with big academic medical centers. And I was among the first investors and took him to some of the best VCs in the world for technology startups, Union Square Ventures and Bessemer Ventures. And, you know, he's a rare cardiologist that is a fantastic entrepreneur and designer. And it was born out of a problem that he saw himself as a patient with his wife, and they extended it to really design in a patient-centric way a new system. One of the companies that I'm most excited about is Podometrics, which was started by an MIT Sloan MBA, who was also a physician, Dr. John Bloom. And it was started over 10 years ago at one of our very first events. But as you know, healthcare is slow and it takes clinical trials. And over the last 10 years, he not only raised multiple rounds of funding, but proved out a system that is pretty revolutionary. And what it is a mat that you stand on, that patients stand on, while they're brushing their teeth or in the bathroom, and it maps the bottoms of their feet as a heat map. And this is specifically for diabetic patients that have risk of foot ulcers developing. And they developed it in combination with the Veteran Affairs Healthcare group, as well as Kaiser Permanente. And in those clinical trials, they caught, on average, 97% of developing foot ulcers, on average 6 weeks before they would have seen a doctor. And what that means is you can intervene and you can prevent these diabetic foot ulcers, which are not only responsible for wounds and a bunch of wound care, but all of the downstream amputations that diabetics often have to have. And in their clinical trials and after, now that they're launched nationwide at scale, they are eliminating all downstream wound care and amputations in these patients, which is fantastic for the patients, but also fantastic for the health system and all of the high-cost care that would happen if you needed that wound care.